All right, guys, so today we are going to chit-chat a little bit about different geriatric patient considerations. So I gave you all a handout there, and if you'd like a pen or something to take some notes, let me know. So geriatric, when I started out as a dental assistant, geriatric patients intimidated me. I don't know if it was just because a lot of them needed wheelchair transfers, or I don't know, they're a harsher, more direct patient, or if it's the fact that when they sit down in the chair, you don't just get to talk to them about brushing and flossing and their diet and are you eating too many crackers like every kid, They sit down and we're like, you need some fluoride, you need less sugar. But geriatric patients have so much going on. And so I was actually dental assisting in Great Falls, and the dentist that I was working for, he happened to be gone that day. He called in sick, and I didn't love my job or anything like that, so I was very excited, and I got to shadow the hygienist there that day. And it was like her fourth patient down, was one from a nursing home. She was wheelchair bound, and so she was pretty excited about it. I was like, why would you be excited for the wheelchair bound patient? And she started talking about how geriatric patients aren't simple. They're not just an open book. They have different complications, and you have to kind of work with them and work with different products to help solve their different oral conditions. So different learning objectives, and then I have an outline to go through. So a geriatric patient is technically anyone over the age of 65. Currently in the U.S., there is about 54 million older adults, but by the time 2030 hits, there's going to be about 75 million older adults. So that's a pretty big increase. Our baby boomers are getting older. 1 out of every 5 adults will be 65 or older, and that's 20% of the U.S. population. So everyone's getting older, and we're getting more prevalent, which I thought it was kind of crazy that that's going to be 20 million increase. So geriatric patients are at greater risk for chronic diseases, lots of medications on their medication list, which I know everyone gets very sad about when you see the new patient medical history with a million medications. Most of them are spelt wrong, so then you're sitting there Googling, what does this do and what is this? Previous dental treatment, poor oral hygiene, and physical decline. And my grandma is the perfect image of this geriatric patient. So she has lupus. She takes so many medications that one of my aunts comes over every Friday and fills her little AM, PM pill box so she knows when to take things. We realized a couple months ago she wasn't taking most of her pills like she was supposed to be. She has had quite a bit of dental treatment. Hates going to the dentist now. She really thinks she's going to die here soon. So she wants to skip all of her appointments. It's kind of funny. My aunts will come grab her to take her to the dentist. She's like, oh no, they'll be good. They'll be good for the rest of the years I have left. Grandma. Her oral hygiene has gotten worse as she's gotten older. She now has created new habits. Now that she's widowed and older, she likes to go to bed at 7. She watches TV and reads her book and snacks. She's a snacker. So she'll sit in bed, she'll snack. She'll brush her teeth before, but then snacks after. Grandma. And physical decline. She just sees herself going downhill. She started using a walker. It's harder to get around. Another reason why these older individuals don't want to come to the dentist as often. So most geriatric patients, 80%, have at least one chronic condition, and about 68% have 2 or more chronic conditions. High blood pressure being number one, which we see a ton of and then struggle with. Well, what do you do for dental treatment if their blood pressure is too high? High cholesterol, arthritis, and this is, I know, kind of small up here, so it's on your handout as well for EW. Okay, so how age can affect the oral health. So your oral health is kind of like the rest of you. As you get older, your cells renew at a slower rate. Your tissue becomes thinner and less elastic. Bones become less dense and strong. Your immune system becomes weaker. And you think about that overall, oh, I'm getting wrinkles, or oh, my bones are weaker, and my doctor says I need to drink more milk, but people don't think about it when it comes to their mouth, and they don't think about that, oh yeah, it's bone that's holding my teeth in there too, and oh yeah, my gums are less elastic. So these aging things that are happening with the rest of our body are also happening in our mouth, and it's important to stress that to patients. Okay, so most common thing that older people start to struggle with, like my grandma that likes to snack, is dental caries. So they notice dental caries often commonly on their roots because they'll start to have that bone loss as they age, the periodontal disease. And so you can see, like here in this picture, this person's starting to get some root caries there, some root caries in those spots. So as their partial dentures rest there on the space, they'll get food stuck there and start to get cavities, or those exposed root surface. They start to notice, lack of dexterity. So maybe they'll be brushing one side better, or the outsides, the facials better than the insides, not getting to those root surfaces as well. Shift in diet, eating more quick things. A lot of them don't love to cook as much when they get older, so you'll find them getting like lunch maybe from the senior center, but then for dinner they're just having one of those boost shakes, or they're eating some crackers, or microwaving some soup. So those easy, quick things. Poorer oral hygiene starts to go downhill, decreased salivary flow, and then increased number of medications, which those two can kind of go hand in hand, which we'll talk more about later. So a lot of different aids to prevent dental caries for geriatric patients, and we have a ton of these in the office with, the Prevident. We do fluoride applications, and you commonly think about that with kiddos. Like every kid that comes in, we apply fluoride on, and then they go through their adult years, they're taking good care of their teeth. We don't necessarily apply it everywhere, but then when they get older and we start to consider some of these things, it's another thing that you need to consider when they come into the office. Like, oh, Mary has a ton of new cavities. Maybe Mary would benefit from some fluoride varnish. Custom fluoride trays, which I don't think we've done a ton of in the office, but we've talked about it for certain patients. Like, oh, maybe they need some fluoride trays to wear at night. Xylitol lozenges, nutritional counseling, and oral hygiene counseling. We do a lot of nutritional counseling with those kiddos too, but often skip that geriatric patient population. And I've noticed like Dr. Kennedy more commonly now has been talking to older people about crackers and processed foods, and it kind of just comes full circle as people age. You have to go back to, okay, what are your habits? Oral hygiene counseling with the tell, show, do method is one of the best, because you can sit there and show people on, and talk to them with the aid about, okay, so you need to use this to go between your teeth. But grabbing a model, so like I just recently got this guy, grabbing a model, and you can floss these teeth, you can brush them, you can take anything in and around. They're not glued together, so they're freely spaced, so you can get in there and actually keep them clean with floss. So this is a great model to grab for any tell, show, do exercise you have with any aids, and we'll talk about some more of those. So gingivitis. So as patients' oral care decreases as they age, their likelihood for gingivitis increases. So gingivitis is, when the gums are inflamed and they bleed. Healthy gums shouldn't bleed, which is the precursor to periodontal disease, and it occurs when plaque and tartar build up and start to inflame the gingiva. So I'll go along because I think I talk about perio next. Yeah. So periodontal disease is the result of infection and inflammation of the gums and periodontium that support the teeth, and you see it a lot in older adults. I like to tell people when I'm trying to explain what perio is, which we have that awesome perio model up front, so if you're ever talking about it, go grab it. But I like to talk to them about how when that plaque and bacteria gets under their gums, it's kind of like a sliver. When you get a sliver in your finger, it gets all red, it gets sore, it bleeds, and then it festers. So your gums, when they have irritants underneath of them, they want to get rid of them. They get red, they get sore, they fester, they bleed, and then your bone starts to pull away. So people will say, my teeth gums are bleeding when I brush, or I'm getting larger spaces in between my teeth. Or I have bad breath and that horrible taste. Well, if you've got something building and growing on back there, that bacteria is just festering. Or my teeth are loose, which sometimes people don't say that initially because that tartar, that bacteria is holding them together in there. But then after they get them clean, they're like, you made my teeth loose. Anyway, so the risk of periodontal disease increases as we age because we're not brushing and flossing daily. We're not going to the dentist as frequently. People that are smoking and using tobacco increases your risk for periodontal disease. More systemic diseases going on, which all increases your risk of periodontal disease. More dry mouth due to medications, and then just your weakening immune system with all that stuff going on. So, aids to prevent periodontal disease. Electric toothbrush. We talk to everyone about an electric toothbrush, and they're amazing. Once you go electric toothbrush, you never go back. They get into all those spaces, easier to use. It's a funky thing for older people who have never used an electric toothbrush to use, so you kind of actually even have to talk to them more. Like, this is gonna tickle the roof of your mouth, and it's gonna vibrate, and it feels really funky. And it also to them feels like it's not doing as good of a job. People will tell you, well, it's not getting in there. Let it do its thing. It's proven to have made a difference. So interdental aids, older gentlemen are toothpick users. They'll come in and they'll tell you, well, yeah, I use that toothpick and then I put it in my hat and then I take it back out and I use it again.
Yes.
So then we have patients like that gentleman that came in that broke his toothpick underneath his gum line, his wooden toothpick, and he had to send him to the periodontist to get it out, and he had to have surgery. So there's so many better aids to use nowadays, and I brought some of the ones that we have in the clinic down here. So we have options like, so these are kind of like toothpicks, only they have a soft end that has little pokey bristles on them, and there's 4 of them in this pack. So I often give these to patients, and I'm like, try these out. See if you like a much better alternative to toothpicks. You're not gonna lose any of them. We also have them in curved, because sometimes those hard to reach back areas, you can get them with the straight areas as well. And showing them how to use some of these, like grabbing the model and being like, okay, so you see in this area, or do it with them in a mirror. You see that area with some recession going on there, and actually use it. Be like, okay, if you can get back there and clean around the gum line, it's gonna make a huge difference. We also have like longer aids. So these have a little brush on each end to kind of get in between the spaces and clean. And brushes do an awesome job, because instead of just getting the surfaces where they touch, it doesn't fill with a toothpick the spaces there, but the brushes do. The brushes fill the contour of each tooth and actually can get it clean if you're brushing in there. So we have different sizes at the clinic. We have these ones with a long handle, and the brushes on these are kind of small. So if it's a bigger space, might not be the best option, but like guys with bigger hands or something that can't reach the back teeth, these are pretty cool. And we have this one as on a stick. This is like a little tufted brush, and I find that people that have perio love this because they can get way back there and kind of on the root surface because it's tiny. Those cheeks hug those teeth so much. So if you can actually take this and get it way back there and keep that area by the gum line clean, this is a good one. And then these little brushes are a lifesaver for people with braces or anybody with perio. This is probably the closest example to what they're showing here in this diagram, but they do have different sizes. So like this buddy is huge, but people with perio, they get really big spaces and it's hard to keep them clean. So we have different options, and you guys can kind of dig around in the drawer and be like, what's gonna work for them? Sometimes I take out a couple and test them, like, oh, this one's not gonna fit in your space, but the pink one's your size. So you can go through and kind of mess around with some of those fun ones. We also have a couple different brands, so feel free to dig and kind of go through. This one has a little bit of a longer stick, and its bristles are pointed back a little bit. Find fun aids and use them with people. So we also have chlorhexidine mouth rinse in in the clinic. So if you have patients complaining of when they sit down in the chair, they're just coming in for an exam, but their gums are bleeding every time they brush and all those good things, you might want to start thinking about, okay, what can I give them today? They haven't seen Mackenzie yet, they haven't gone and had their cleaning, but what can I help them with today that's going to make a difference? Like, maybe let's start you on some chlorhexidine, or maybe let's give you some little interdental brushes to start using now, that when you get there, you can be like, oh yeah, I'm already using these brushes. Okay, great, let's get you clean. Let's keep this habit going. And then we can just build habits, better habits at each appointment with things. So another cool thing that I recently got that we have in the clinic is chlorhexidine varnish. So after I do scaling and rate planings, I'll take, it's kind of like fluoride, kind of cool on some of these patients with really good recession, and it has a little brush in here and a little cannula, and you open it, and then I just paint it around the areas I've cleaned. And it's kind of hard because usually the tissue doesn't look the best and there's, some fluids everywhere, but I just try to get it really dry and apply it. And I haven't had people present back enough yet to see if it's making a pretty good difference, but I've read some good things about it, so I don't know if you want to pass any of that around and check it out. But they're constantly making new different aids and tricks for us to use. Dry mouth. So the patients that sit down in the chair instantly will tell you, my mouth is so dry, and especially when you're going through those medications. Sometimes I'll find them on like med number 4 that I'm typing in, and I'm like, what do you take this for? And they'll start telling you, those meds I'm taking, they make my mouth so dry. And super common with geriatric patients, and you can't tell them, well, if you stop taking, your antidepressant, or if you stop taking your blood pressure pill, you can't have them stop taking their meds. So we kind of have to find funky ways to work around it. So big side effect of medications, age, different health conditions, so like chemo and radiation will play a huge role in salivary flow, especially if it's head and neck. So top medications that cause dry mouth. So I put this on your handout as well because you just forget, and it's tiny up here. But a lot of Alzheimer's meds, different urinary incontinence meds, antidepressants are a huge one that you often see causing some dry mouth. Bisphosphonates, blood pressure meds, decongestants, diuretics, bronchodilators. And these are a lot of things that people use every day. And then you combine 1, 2, 3 of these medications that someone's taking, and there's just no way around it. So you kind of have to find solutions to work with them. And they make good products. I'll go on here and they talk about a few of them. So you want to stress water consumption, keep a glass of water by the bed, or make sure you're drinking water all throughout the day to keep that saliva flow going. Stress the water consumption. And sometimes people will say, yeah, I drink water, but I also drink sweet tea. Well, we're helping the dry mouth, causing the cavities. So you kind of have to find a good, happy solution there. Some people tell you they hate water. All right, so let's come up with a different solution. So xylitol products are kind of a newer thing, and you guys have probably all seen that we have spry gum and we have spry lozenges in there. So they have xylitol. Xylitol works because the streptomutins that are in our mouth don't feed off of xylitol. So xylitol is a natural sugar, a natural sweetener, but those streptomutins don't feed and build on that, so it helps prevent cavities. And they say that the more you use xylitol, the better it gets. So patients that have long-term use with xylitol can actually lower that plaque consumption and help. Xylitol does, if you're taking a lot of it, it will upset people's stomachs occasionally. So you want to mention that. And then it's also, I think, toxic for pets. So you want to keep it away from your pets. Sugar-free mints and lozenges are a great solution. And sometimes, people don't want to chew gum all day. So finding something that's a sugar-free lozenge, we probably don't want our patients chewing gum all day, but anything to help with their dry mouth. So they make biotin, which is a dry mouth rinse, and we used to have a ton of little samples of it. Some people find that it helps with dry mouth, but others say, you know, it helps for like 10-15 minutes, and then I'm back to having a dry mouth. We have a Prevenant dry mouth rinse. So this is like the Prevenant toothpaste for people that aren't great brushers even, or these people that struggle with constant dry mouth. Giving them something like a Prevenant Prevenant rinse might be a better solution, because they can use it, rinse with it, keep going with it, and it's not something that, oh, I had to stop and brush my teeth in the middle of the day to keep it moist. Talking about tobacco counseling, tobacco tend to dry out your mouth, so will alcohol use. Nutritional counseling, which kind of, I mean, with nutritional counseling, you definitely want to stress water consumption. You know, after you eat, make sure you're drinking lots of water so it doesn't just stick. Because those dry mouth patients, it is bad. Like, their tissue sticks, and they get little like indents on their tissue where their teeth are supposed to be. And then always, if you're going to give someone something new to do, anything, whether it's an interdental aid or a tongue brush or a new toothpaste, the Tell, Show, Do method works great. And especially with geriatric people that don't understand as well. Like, oh, she gave me this, but I'm not really sure what it was for. You know, if you sit there and actually talk to them about how to use it, you're gonna have a better compliance rate. All right, so next we have candidiasis. So it's a fungus affection that is common in older adults with weakening immune system. So I don't know, have you guys ever noticed someone's tongue looking kind of funky when you saw an exam with some buildup on it? No? Yes? So it's a yeast infection. You can also see some of these dry red corners of the mouth, and occasionally that's a vitamin B2 deficiency. But sometimes in our Montana weather, it's hard to know, are they deficient? Are they really dry? Why are they cracking? So a few different aids to help with candidiasis. So tongue cleaner. I love these tongue cleaners. So we just got these a while ago, and I had my first patient the other day ask me, can I have another one of those tongue cleaners? And I was like, oh my gosh, yes you can. So they're really great, because then you're not scrubbing aggressively with your toothbrush. That tends to make people gay. I don't know what it is about the tongue cleaner. Does a really good job, doesn't make patients gay quite as much. Advising them to eat some yogurt, different probiotics, which I know we do also when put on antibiotics, but that helps with the candidiasis as well. Saltwater rinses. If Dr. Kennedy or Dr. Ryrie sees someone with pretty severe candidiasis infection, they'll tell them, you know, occasionally, oh, we need to put you on some antifungals. Tobacco counseling, nutritional counseling, but realistically just talking about keeping it clean, consuming water, and sometimes antifungals are needed. Okay, so denture stomatitis. A lot of geriatric patients have lost all of their teeth. They're coming to us with a couple teeth, maybe on the bottom or a couple on the top. So you kind of have to help them, you know, keep their denture clean. And you guys often see me in there shaking their dentures or their partials. And occasionally they'll come in and be like, it's really red under my denture, or my denture's rubbing and it hurts. And I went back to see the denturist, but this is still what it's like. So a lot of the times, if denture stomatitis is from the candidiasis yeast, and if it's not from rubbing improperly, it will be asymptomatic. They won't even know that the roof of their mouth looks like this. But sometimes it burns, depending on the person and depending on the severity. So the number one thing to prevent denture stomatitis in geriatric patients is a clean denture and taking it out at night. So talking to patients, and usually the denturists do this when they give them their new denture, give them all these instructions, a little pamphlet to send them home with, but not always. And if you've had dentures for forever, you forget. And a lot of us women, we're vain. They don't want to sleep without their denture. So talking to them about cleaning their denture in the morning at night, using a mild soap or like the denture cleaning tabs, you know, but something that's not abrasive, gonna scratch it, get all the bacteria off of it before they plop it in their mouth the next morning. Talking to them about cleaning their gums. A lot of times people take out their denture, put it in the thing, they'll brush the couple teeth they have, but they don't do anything with the rest of their gums that they're resting that denture on all day. So talk to them about brushing those areas, keeping it really clean, and that'll just help with any bacteria that's been sitting up there, trapped under their denture all day. And then, big one, taking dentures out before they go to bed at night. Yeah, a lot of our female patients won't, or they used to instruct them, I've been told by a gentleman, that he was supposed to leave his denture in for the first 4 months through the night, and he just doesn't take it out. And convincing those patients to take it out is hard once their denturist told them they shouldn't. So, oral cancer is something that we screen all patients for, but the likelihood of oral cancer increases as we age. So, the American Cancer Society estimates that 54,000 people in the United States will be diagnosed with oral cancer in 2021. But the majority of oral cancer patients are over 62 years of age, so hitting that geriatric range. And common causes: tobacco and alcohol use, sunlight, exposure to sunlight, poor nutrition and oral hygiene, HPV, and marijuana use has now been linked a little bit more commonly to oral cancer, and it'll be interesting as marijuana use becomes more prevalent to see what they find with its link to oral cancer as well. So common locations for oral cancer are lips, the gums, the tongue, the inner lining of the cheeks, the roof of the mouth, the floor of the mouth, and you can kind of see in some of these pictures, a lot of people think around their mouth and their lips are sunspots, which they kind of are, from being out, but once you start to see that the border isn't super well demarcated, you start to worry a little bit. And Dr. Kennedy is good about this. She'll tell people, have your lips always looked like that? Or she'll talk to them about, are you in the sun a lot? Are you wearing sunscreen? She's pretty good about that one. And then just making sure we're checking tongue, cheeks. And sometimes people will come in and be like, oh yeah, I bit my tongue. Well, has it always been like that? Has that been there for the last month? And we'll talk to them about watching it to make sure it heals. So, routine dental checkups. At each one of my exams, and I think they do it at comp exams too, both dentists go through, check all these areas of the head and neck, and sometimes they'll be like, it was good, and if they don't say anything, I usually assume that it was good. Discussing with patients what to watch for at home, showing them the spot that, okay, Dr. Kennedy today found this spot on your tongue, showing them in a mirror, being like, this isn't normal, and if it doesn't go away in the next week or two, you should probably come back and have it checked out. If it does go away, okay, well, you just bit your tongue, it's doing good. And a lot of the times when individuals are older and we notice some sort of new lump or lesion, whether it's on the side of their tongue or the floor of the mouth, we'll have them sent off for a biopsy. So, along with all of those different little things that we can help patients with when they come in, whether it's just a little quick tidbit, at an exam, like, oh, you should try taking home this tongue cleaner today, and that could help with your bad breath until we get you in to have your teeth cleaned, or if you want to try to combine a couple things at once and send them home with some Prevident dry mouthed, we'll help you with some of those root cavities that you have right now and that dry mouth at the same time, and we'll see if this makes a difference, and then at your next visit, we'll, kind of go from there, and tweaking and trying some different aids will also be helpful as you go. Geriatric patients often need different appointment considerations. So Donnie is pretty good about, patients coming from the care center. She'll schedule them in the afternoon, so she knows they're up, they're going, someone's gonna be there and available to bring them. They're not ever our 7 a.m. patient. Shorter appointments is a big one. A lot of times they'll lay in the chair for a while and be like, that was horrible, you were in there forever. Sore jaw. Often they have different body temperature regulations. So you'll notice they'll want like to keep on like the heavy vest after taking x-rays. My mom is one of those people. We have the weighted blanket, so I brought the blanket cover today. Don't forget to, grab that occasionally if someone's cold. You think about it just for anxiety, but those older patients struggle with regulating their body temperature. Pillows, different pillows, neck pillows, leg pillows will help with if they had, a joint replacement, or their lower back hurts, or their neck can't lay back all the way. Just different things like that. And you can get creative with the pillows too. And some patients, you find, actually even bring their own pillows because they know, well, I'm going to want to sit on this, or I'm going to want to put this under a leg. But if they don't, and you can see that, one of these aids is going to help the appointment, a lot nicer to grab it at the beginning, try to get them comfy so that they can make it through the appointment. So geriatric patients often, as they get older, have limited dexterity. This was actually a project in hygiene school we did. You had to get creative and everyone had to come up with a different aid to help someone hold on to a toothbrush. And they gave us like a condition, and then you had to come up with something to help them hold on to the toothbrush. So it was kind of cool. I did something kind of like this bike or like this strap one, so the patient could put their hand in there and then strap it down and use it to brush if they couldn't actually grip. But some of these, like an arthritis patient might not be able to hold on to something skinny, but if you put like a tennis ball on the end, their fingers could grasp onto that and they could kind of get back in there. And some people might not have a tennis ball sitting around, so you could use something like a towel, and getting kind of creative with different ways. This one, it looks to me just kind of like a rubber band around his hand, but anything that's going to help him be able to do the job, and getting creative with different tools. Okay, guys, so you have to actually get involved now. So I have a couple case studies with some questions, and I just want you guys to throw out some ideas. So for this first one, I can show you what we're doing here first. This one is a patient that answered yes to having some hot and cold sensitivity. She came to the office today because of her sensitivity. She doesn't have any dry mouth. She doesn't think she has periodontal disease. She doesn't have any bleeding when she brushes or flosses. She doesn't know when she was last at the dentist or even remember what they did, but she knows she's having sensitivity today. She does have a partial denture, and this is just a little bit about, she visited Dr. Smith recently. So based on her medical history, if I was just reading this out of her thing, I would guess that she was mostly concerned with her sensitivity today. And then I would think that she would want to talk about that, whether we started giving her aids like some Prevident, or talk to her about if she's ever used Sensodyne, if she has, root caries going on that might cause that sensitivity, she's going to need to come back for some cavity appointments. Just little different things like that might be what her appointment entails. And for aids or instructions that we could give her today, if she wasn't getting any treatment done at that appointment, I'd probably start her sending her home with some Prevident. See if that goes anywhere first, and then we can try something different out. Okay, so here's an example one. So this patient came into the clinic today, and her female, 75-year-old female, she is having her gums bleed when she brushes and flosses. She has had periodontal treatment in the past, but it was a few years ago and she doesn't really remember when. She does drink bottled water. She does have some pain and discomfort when she's brushing and flossing. That bleeding is pretty sensitive. She had a cleaning years ago. She does go to the doctor. She's taking a multivitamin and some blood pressure meds. And she has been hospitalized within the last 5 years, but she did not tell us why. Sounds like a lot of our patients. Based on her medical history, what do you guys think that she's mainly concerned about today? bleeding gums, periodontal disease.
It's your gums.
Yeah, her gums. And you might not want to jump in and be like, you have periodontal disease right away, but she
Do an
knows.
evaluation,
Yeah. And so she'll probably eventually have to be scheduled back for some of that treatment. What do you guys think that are some aids that you could give her or talk to her about at the appointment that might help her out?
All those things, like the go-betweens,
Yeah.
help a lot. They got a lot of spacing in there.
Yeah.
So.
And for these patients, feel free to dig through the drawer. I mean, grab a couple different things, take them in there and be like, well, you could try a few of these things and see, because everyone's a little bit different too, and each patient will like something else
Differently.
better. Yeah. Yeah. So, this patient is having pain when she's chewing. She's 70. She's having pain when she's chewing. She does have some hot and cold sensitivity. Her mouth is dry. She has had periodontal treatment. She does drink unfiltered water. She's taking a ton of medication, ibuprofen, melatonin, high blood pressure meds, anticonvulsants, antihistamines, different medication for GERD, depression medications. What do you think some of her main oral concerns are today? Pain. Yeah.
Sensitivity to hot, cold.
Yeah. And so she'll probably have to come back for some treatment with that pain, whether it's cavities for the sensitivity, or that could also be causing the pain when she's chewing. And she did say that her mouth is super dry, so even taking a few minutes to be like, okay, let's drink extra water, doing a little tidbit of nutritional counseling at the end of the appointment will help a ton. And giving her something to leave with that, okay, this might help fix my problem. That'll be huge, and we can start doing that at all the little appointments. Tweak in and...
Your Prevident would be good to put in there.
Yeah, Prevident. Yeah, that's a great idea. Okay, now we have an 88-year-old male. We're not picking on the girls. And he came in for a dental exam. He has a pretty dry mouth. He does have some dental pain. He has some sores in his mouth, and the roof of his mouth is burning. He was last into the dentist. He does have dentures. He was last into the dentist 10 years ago for full mouth extractions. He's wheelchair bound, which has just happened within the past couple of years. What do you guys think his main oral concerns are today?
Papillary hyperplasia, probably.
Yeah. And you guys, what do you think that we would do for him at that appointment? What are some ideas would we talk to him about with his denture?
So clean his denture.
Yeah.
As good as you could, and then also discuss with him if he's taking it out at night, give him the chance for the tissue to heal. You could always use some mouth rinsing, like Prevident, like the chlorhexidine or something like that.
Yeah.
So,
perfect. And we do have like some denture brushes. We even have some containers that they can put them in and store them in. At night they have like a little drying rack, so if he brushed it before, to keep it clean, like you were saying, and then if you want to put it in there, it'll help it dry so that it's ready and clean for the morning. And just talking to him about those instructions. And our clinic doesn't currently have like a pamphlet or a printout on denture care, because we kind of hope that the denturist does it, but that might be something that would be good for us to get to send home with them, because a lot of those geriatric patients struggle with remembering what we told them when we go home. So you hope that things like the tell, show, do method, or giving them different aids will help, but everyone's a little bit different, And so implementing and talking to them about these things at each appointment will be super beneficial. Okay. That is all I have for you guys today, and lots of references.
Wow.
But geriatric patients are a whole different ballgame. So I hope that some of these things now, when you're doing intakes and people are talking to you, they catch the dental assistants before they catch anyone else being like, oh, this tooth hurts, or like Whitney today, got stuck in talking to a patient about his blood pressure meds, and then he wanted to talk about his tooth. Like, they are going to tell you guys their problems before they even catch the dentist. So sometimes if you're waiting, or, you know, have that patient for a little bit before the dentist is ready, finding some of these aids and helping them out, you know, whether it's even giving them the xylitol lozenges, to be like, you should try these, you know, because there's something you can kind of suck on that's not going to give you cavities. Any of those things that we can catch them with early and talk to them about will be hugely beneficial. So, yeah. Thanks, guys, for listening.
Woo!